Tuberculosis. Ayurvedic aspect about tuberculosis. Definition: tuberculosis is a contagious infectious disease caused by the bacterium Mycobacterium tuberculosis. It primarily affects the lungs but can also affect other parts of the body. Modes of transmission: TB is primarily transmitted through the air when an infected person coughs or sneezes, releasing respiratory droplets containing the bacteria. It is an airborne disease but generally requires prolonged close contact for transmission. Key facts: latent TB infection (LTBI). Description: individuals with LTBI have TB bacteria in their bodies, but do not exhibit symptoms and are not contagious. Risk of progression: LTBI can progress to active TB, especially if the immune system weakens. Active TB disease. Description: individuals with active TB experience symptoms and can transmit the bacteria to others. Symptoms: persistent cough, unintentional weight loss, night sweats, fatigue, and chest pain. Diagnostic tests: chest x-rays, sputum tests, and TB skin tests are used to diagnose active TB. Drug-resistant TB. Some strains of TB bacteria may develop resistance to commonly used anti-TB drugs. Drug-resistant TB poses challenges for treatment and control. Treatment. Drug therapy. Standard TB treatment involves a combination of antibiotics taken for several months. Directly observed therapy. Ensures that patients take their medications as prescribed. Drug-resistant TB requires a more extended and complex treatment regimen with second-line drugs. Prevention. Vaccination. Bacillocalmette-Guerin BCG vaccine is used in some countries to prevent severe forms of TB in children. Infection control, proper ventilation, respiratory hygiene, and personal protective measures help prevent TB transmission. Treatment of latent TB. Individuals with LTBI may receive preventive treatment to reduce the risk of progression to active TB. Global impact. TB remains a significant global health concern, particularly in regions with high prevalence. Efforts to control TB involve early detection, appropriate treatment, and public health measures. Challenges. Drug resistance. The emergence of drug-resistant TB strains complicates treatment. Co-infection with HIV. TB/HIV co-infection is common and poses additional challenges in managing both conditions. Public health strategies. Screening and testing. Identifying and testing individuals at risk for TB. Contact tracing and testing individuals who have been in close contact with TB patients. Education and awareness. Promoting awareness of TB symptoms, transmission, and preventive measures. Timely diagnosis and appropriate treatment are crucial for managing TB effectively and preventing its spread. Individuals with symptoms or at risk of exposure should seek medical attention for evaluation and testing. Ayurveda aspect about tuberculosis. In Ayurveda, tuberculosis is referred to as Rajayakshma or Shwasakasa, depending on the predominant symptoms and involvement of doshas. Ayurveda views tuberculosis as a complex condition involving an imbalance of the doshas Vata, Pitta, and Kapha, leading to the manifestation of symptoms. Dosha imbalance. Vata imbalance, often associated with dry cough, weight loss, and fatigue. Pitta imbalance may manifest as fever, inflammation, and increased body heat. Kapha imbalance linked to respiratory congestion, phlegm production, and heaviness. Ama formation. Description. Ayurveda emphasizes the concept of ama, which represents toxins or undigested substances in the body. Role in tuberculosis. Ama formation is believed to contribute to the progression of tuberculosis. Dhatu involvement. 7 dhatus. Ayurveda recognizes 7 bodily tissues, and TB is thought to affect these dhatus, particularly the respiratory pranavaha and nutritive rasavaha systems. Ayurvedic management. Balancing doshas. Vata pacification to address dry cough and fatigue. Pitta pacification to manage fever and inflammation. Kapha pacification to alleviate respiratory congestion. Detoxification. Panchakarma therapies. Ayurvedic detoxification. Procedures like Vamana therapeutic, vomiting, and Virachana purgation may be employed to eliminate excess, doshas, and ama. Rasayana therapy. Description. Rasayana refers to rejuvenation therapies that aim to strengthen the body's tissues and improve immunity. Role in TB. Rasayana therapies may be recommended to support the overall health and vitality of individuals recovering from tuberculosis. Herbal formulations. Anti-tubercular herbs. Ayurvedic formulations often include herbs with potential anti-tubercular properties such as ashwagandha, tulsi, neem, and guduchi. Expectorant herbs to address respiratory congestion and promote the expulsion of phlegm. Dietary recommendations. Balanced diet, emphasizing foods that pacify aggravated doshas and promote digestion. Warm and nourishing foods to support the healing process. Lifestyle modifications. Adequate rest to facilitate the body's recovery. Stress management, as stress can contribute to dosha imbalances. Ayurvedic interventions for tuberculosis are typically individualized based on the patient's constitution prakriti, the severity of symptoms, and the specific dosha imbalances involved. It is essential for individuals with tuberculosis to consult with a qualified Ayurvedic practitioner for personalized guidance and treatment. Ayurveda is often used as a complementary approach alongside conventional medical treatments for tuberculosis. Thank you for watching my video. Please subscribe my channel.